Hey class, my name is Daniel Calvillo. I am currently located in Utah. The practice that I'm currently rotating is called Premier Family Medical. They are a family practice clinic and they have quite a few providers at that same location. I've been rotating with multiple of them and currently rotating with our nurse practitioner. Um, they see all ages of patients from infants to geriatrics and everything in between. So it's been a really good learning experience being there. Just to kind of give a brief description of what's going on with the patient. The patient's a 42-year-old female. She presents to the clinic complaining of right knee pain. She states that her knee pain was exacerbated 5 days ago. She was helping someone move, and while she was helping someone move, she kind of tripped over an uneven stone or uneven step and then fell right on her right knee, caused a really bad abrasion. Has been having really bad pain ever since. She states that pain can get anywhere from 6 to 8 out of 10. She's described as being very consistent and dull and very achy. She does say that once she's on her knee for like quite a few, when she's on her knee for a while, it starts to swell up pretty bad. And then she still has lots of pain and she has to bear a lot of weight on it. Um, Past medical history. The only one thing she has, she's anemic and she has celiac disease. Therefore, she's allergic to gluten. No other allergies there. Social history. She is a single mom of 3 kids. She's also a home health nurse, is what I learned. And because of it, she really tested my knowledge, especially when I was trying to do a lot of these manures and diagnostic physical tests while we were trying to figure out if there was like a ligament injury, a meniscal injury, ACL injury. She was very, and I'm assuming she was doing it because she really wanted to know what was going on, but she was really testing and it was keep it in, relax, you got this, keep going, explain every single detail you're doing, keep her involved, let her ask those questions, um, and making sure that she's just felt like she's been listened to and being heard. I know we all had those patients. Um, so this is what made it very memorable, and it really tested my memory and my knowledge as to why I'm doing all these tests. In the past, we've had patients that had a really bad injury on the knee, and so some of them we sutured up, some of them we cleaned up and like patched them. Other ones they had a very significant fracture when the X-ray came back, and it was very easy to say, "Oh, you have a fracture here, so we're gonna do this, this, and that." So yeah, and I'll continue on why of some of the other diagnostic tests that we did that it was kind of interesting to ensure that I knew my stuff when doing all these different types of assessments. Review a system. She doesn't have any fever. She feels good. Otherwise, other than that right knee pain that she's having, she just complains that it does swell up and she still has a lot of pain and it's tender and that she still has that abrasion. Vital signs were normal. Other than that, assessment. So some of the differentials that we were considering based on what she was telling us and that we wanted to rule out was like a knee sprain or a contusion, a patellar fracture, or a meniscus injury or tear. So some of these tests that we did to kind of help us narrow down the diagnosis, um, we did a Lachman's test, which gave us a negative result that there is no ACL injury. We did a valgus and a Vargas test, just kind of identifying the collateral ligament injuries, which was also negative. We did a McMurray's test, which also told us that there is no meniscal tear. We did an anterior and posterior drawers test. Again, lets us know about the ACL and the PCL, that there is no injury there, and that everything was working properly. The patient was very persistent that she wanted an x-ray, so we ordered her that x-ray, took her upstairs to get that x-ray, brought her back down once it was done. We made sure that there was no fracture present, not even on her kneecap or anywhere on the knee. Mainly just kind of reassure her that this is possibly a contusion or a sprain and that she really does need to rest it for these type of injuries, it is a time thing and she needs to take it easy, which was very hard for her because I feel like all of us nurses are go-getters, and so we want to get things done, and we're helping others. We don't really take care of ourselves. We're always looking out for everyone else. And she really had that personality. Um, so the ways that we kind of confirmed it was a knee contortion, like we said. We performed all these tests. We even did the x-ray, came back that there was no fracture. Um, and that was like our way how we kind of critically thought our way through it. My preceptor does have this really awesome book that helps us with like bones and injuries and things. I kind of forgot the name of the book, but it was a really good one. And some of the resources that we used to kind of help us narrow it down was we used the clinical practice guidelines from the American Family Physicians website. We also did from the guidelines of interventional therapies for knee pain from the American Society of Pain and Neuroscience. The plan for her that we did is that we wanted her to rest. Ice it as much as you can. Try not to be on it as much. Take it easy for a couple weeks. Try to involve her kids. She does have some older kids that are within like their late teens, and kind of said, let's ask them to help and do some things within the house while you can rest and recover. She does have a friend that lives nearby that was going to help her kind of coordinate some other things, especially like some meals and cooking, so she could stay off that knee. Someone was going to also help her with a wheelchair, I think, if I remember correctly, or even just like with a brace. If not, she was going to look into buying a knee brace to kind of help remind her she needs to take it easy. Um, and she really didn't want to do physical therapy at the moment, so she said she wanted to wait, but she wanted the referral still just in case. So if she does decide to do the physical therapy, she's able to do so. So we ordered her that physical therapy referral, so she has it in her back pocket if she wants to start it sooner rather than later after she's rested it for a couple more days. Some of the ways we approached some holistic care was one, we involved other family members to kind of jump in, kind of gave her some ideas of who can or who can't. She most of the time came up with those ideas on her own. She's pretty educated. She kind of understands what she needs to do. Hence why because she's a home health nurse. Some of the Gene Watson's caring process that I feel like we considered. I feel like us nurses, we are one of the most worst patients, and she was pretty difficult because she knew exactly what she wanted, and she didn't want any more, anything less, and was always wanting to ask questions as to know why we're doing this, why we're doing that, why we're doing that, which is good because it helped me learn and made sure that I knew what I was doing and what I was talking about before I just kind of blurted it out. And it was nice, still scary, but it was a good learning experience. So I would say we sustained like a very humanistic environment. We didn't want to be robots. We're doing this, and this. We were able to play it on as to what she wanted, listen to what she needed, which kind of plays into allowing for the expression of positive and negative feelings, making sure she felt like she was heard, and that we were addressing what she wanted and why she was here, and hit that goal that why she came here was to make sure that she did not have a fracture, which I feel like the goal was met after that x-ray that she was very persistent asking for. And so that's my case, and that's how we narrowed it down to be a knee contusion and sprain. It was, again, hard. She really tested your knowledge. I feel like us nurses, when we're patients, we'll do that. We want to know the whys, but why? Why? And it was a good learning experience. That is our case. Thanks, you guys.